My name is Michael Quirke. I'm a consultant in emergency medicine and a research fellow with the Emergency Care Research Unit in the Royal College of Surgeons in Ireland. I was a lead study author for this systematic review and a meta-analysis which examined risk factors for the development of nonpurulent cellulitis of the leg. Nonpurulent cellulitis describes cellulitis that is not associated with purulent drainage, discharge or exudate. It is a significant burden internationally, accounting for up to 3% of emergency department attendances, with an average length of stay of 6 days in UK hospitals. It is both intuitive and supported by consensus opinion that treatment of risk factors such as leg edema and ulceration may promote resolution of the index episode of infection. Perhaps more importantly, treatment of these risk factors may reduce the risk of complications, the most important of which is recurrence of infection. This systematic review was performed in accordance with the meta-analysis of observational studies in epidemiology, or MOOS guidelines. We initially employed a very broad search strategy and applied rigid pre-specified inclusion and exclusion criteria so that only case-control studies examining risk factors for the development of leg cellulitis were included. Methodological quality of included studies was performed using the Newcastle-Ottawa scale, which was performed independently by 2 study authors. Risk factors chosen for final meta-analysis were required to be present in at least 50% of studies that were included and must have been defined in a similar method. So of over 3,500 studies screened, we found that 6 case-control studies met our pre-specified inclusion criteria. Of these, 40 different risk factors were described, of which 8 local risk factors related anatomically to the leg and 4 general risk factors were further analysed. We found that local risk factors were far more significant than general risk factors in the pathogenesis of leg cellulitis. Previous cellulitis, a site of bacterial entry due to wounds, ulcers, skin excoriation or tinea pedis, and leg edema were all significantly associated with the pathogenesis of leg cellulitis. In contrast, diabetes, smoking, alcohol consumption, and to a lesser extent increased body mass index were not associated with the development of leg cellulitis. It's worth noting that patients with diabetes may be more likely to present with purulent infections and may have been excluded from studies. We detected high levels of selection bias in particular, and also publication bias in the case control studies which we analysed. In conclusion, this is the first comprehensive systematic review and meta-analysis to examine risk factors for the development of leg cellulitis, and although limited by bias, does contribute to our understanding of this condition. Concurrent with antibiotic treatment for cellulitis, it is widely advocated that clinicians should treat these local risk factors in order to reduce the risk of complications at the patient's first presentation to an emergency department or other healthcare setting.